Up next in the nursing process is planning. We can expect total output to be at least 1,500 ml per day for a given client. Total intake, however, may be roughly 600 ml greater than output. This is okay because we know that we can't measure or account for the insensible or unseen losses from evaporation off the skin, exhalation, etc. When documenting, it is very important to be accurate and timely, as well as to know when the data needs to be reported to the healthcare provider. A urine output of less than 30 ml per hour would be reported to the healthcare provider because this may indicate decreased renal perfusion. Any weight gain or weight loss that is greater than 2% of the client's baseline weight should also be reported. A gain of 1 kilogram or 2.2 pounds is essentially equal to the gain of a liter of fluid. The loss of 1 kilo or 2.2 pounds indicates a loss of a liter of fluid. In addition, it is particularly important in an ICU setting where urine outputs are usually checked hourly to keep accurate records and to be able to recognize the trends. When implementing intake and output, it is very important to document the intake or output as soon as it is observed. Don't try to remember the value or write it down on a piece of paper. Document it in the electronic health record as soon as possible. The piece of paper is often lost or the value forgotten by the time the nurse gets around to documenting. Record the type of input or output, for example, normal saline or urine. Record the route, oral or IV. Record the volume in milliliters. Make sure when measuring the fluid that you are looking at the meniscus at eye level. Note the man in the photo with the goggles looking at the meniscus of the fluid in that graduated collection device. Each client's output should be measured in their own individual measuring device. Don't measure more than one client's urine with the same measuring device. Intake and output need to be totaled regularly. For example, intake and output are added up and documented every 8 hours or at least at the end of every shift. They are also totaled every 24 hours. This is done so that the nurse and healthcare provider can look at trends over time. Recall, we are really looking for fluid balance over a 24-hour period. We routinely review trends over the course of our shift as well as over the course of a 24-hour or 48-hour period, etc. Please note, though, that in the electronic healthcare records, the totals may be ongoing throughout the shift, 24-hour period, and the client's stay. Client and CNA teaching are required when a client has an order for eyes and nose. We need to make sure that everybody is aware of the reason for monitoring the intake and output and what expectations we have of them. If a person understands the reason for the eyes and nose, it is typically going to lead to more buy-in, which in this case results in more careful measuring and documentation of intake and output. Both the client and the CNA should be aware of what is being measured. The CNA will measure intake or fluid on the tray, but they aren't responsible for measuring and documenting IV fluid intake. That is the nurse's role. CNAs typically measure output like urine, liquid feces, and wound drain output. Nurses are responsible for output like gastric secretions and chest tube output. It is very important for the nurse to know their scope of practice as well as the CNA's scope of practice. Often, when a client is placed on eyes and O's because they are at risk for fluid volume overload, they are also placed on a fluid restriction. If a client is on fluid restriction, it is really important to make sure that staff are carefully monitoring their intake of all oral fluids as well as IV fluids. The nurse will create a plan for the amount of fluid the client is allowed during each shift. It is generally a larger amount of fluid on day shift because there are 2 meals, a smaller amount for evening shift because there is 1 meal, and the smallest amount on night shift because there are no meals. In general, limit the amount of fluid with meals, spread it over the course of the day, and limit salty or spicy foods because those will make the client thirsty. We all know that when someone tells us we can't have something, that we really want it. So offer ice chips to provide some moisture in the mouth, but don't leave any containers of liquid at the bedside with these clients.